Hey friends, if you're watching this, you are immediately postpartum. You have just given birth, you haven't gotten up, you haven't gone to the bathroom, you haven't walked, you're just in bed at this point. And what I'm gonna do is give you a few exercises to connect, check in with your body, check in with your muscles, and try to get things back on board and working for you as quickly as possible. Now, disclaimer, I want you to know that you are not going to feel muscle activation in the same way that you did prior to giving birth. Things are in a different position. Muscles are going to be in different places than they were during pregnancy. So what we need to do right now is focus on connecting the brain to these muscles in their new positions to make sure that we can get them back into balance and firing the right way and getting you moving and feeling good as quickly as possible. So the first thing I want you to do is I'm going to stay seated. You're laying down. I want you to stay in any position that you are in that's comfortable for you. So I want you to focus on diaphragmatic breathing. In pregnancy, the diaphragm is pressed all the way up. There's not a lot of space for it to descend down into the abdominal cavity. So as you focus on this diaphragmatic breathing, I want you to know that it might feel really hard, and that's okay. Bring your hands to the sides of your rib cage, and on your exhale, just apply a little bit of pressure, like you're pressing your ribs together. And then on your inhale, see if you can press or push your arms out to the sides of the room. And you're gonna take just a few of these diaphragmatic breaths, trying to get some expansion into lateral expansion in your ribs. And you can also focus on breathing into the sides and back of your ribs. So if your thumbs are behind here, can you also get a little bit of space into the back of your thumbs? You're just gonna take this for a few moments. This diaphragm, as you know, if you've been with me for a while, is the most important part of reconnecting to the muscles in your core. So if the diaphragm's not firing properly, nothing below it can kind of fall into line. So that's why we're focusing on this first. If you've had a C-section, you might have some tightness or pain in your chest. There's a lot of extra air that can gather in the abdominal cavity. Know that that is normal, somewhat normal. If you're concerned about it, yes, absolutely talk to your care provider about it. But getting this diaphragm moving and mobilizing again in that abdominal cavity is going to help push things around and eliminate some of that pain for you. Next thing I want you to do is tune into the muscles of the pelvic floor. If you've had tearing and episiotomy, if you've pushed for a significant amount of time, know that the pelvic floor muscles are probably not going to respond in the same way, if at all. But I, again, want your brain to think about those three sphincters, front, middle, and back, bottom of the body. As you breathe in, think of everything relaxing. And as you breathe out, just a gentle lift up through the center of the body. In, everything relaxes. And then exhale with a gentle lift. Now start to think of the front versus back specifically. As you inhale, release everything. On your exhale, can you close and lift your pelvic floor at the front? So you're just stopping the flow of urine. Inhale, let that go. And then you're gonna move to the back. Can you stop yourself from passing gas? Inhale, release. And then one more time, front, middle, and back all together. Close and lift. Inhale, let go. Good. For your next exercise from this position, we're going to try to layer on diaphragmatic breathing with a little bit of pelvic floor activation. I want you to physically brace your core. So if you have an incision, you're going to come a little higher. If not, use your hands a little lower, but you're going to put your hands on the outsides of your hips. As you exhale, I want you to think of closing and lifting. So you're stopping the flow of urine, stopping gas, and then use your hands to wrap like you're putting on a corset. Lift a foot up and put it down. Inhale, release. Exhale, close and lift, stop urine, stop gas. Hug those abdominal muscles close to you and put it down. C-sections are going to be higher. You're going to feel those muscles wrapping and releasing. This is just to get your brain to recognize that it can connect to these core muscles even after giving birth in this way where your core supports your movement. So just the tiniest little lift and lower in these legs. I want you to do the same thing, this core activation, as you slide your leg out away from you. So think pelvic floor first, wrap or brace those core muscles, slide a leg out away. Take an inhale to release. Exhale, wrap or brace those core muscles to bring that leg back underneath you. Switch over to the other side. Inhale, release. Exhale, lift the pelvic floor, wrap those core muscles, slide the opposite leg away. Inhale, let go. Exhale, brace your core, slide the leg in. We're gonna take one more right. Brace the core, slide the leg away. Inhale, release. Exhale, brace the core, bring it back. Inhale, brace the core, slide the opposite leg away. And brace the core and bring it back. Awesome. Do this as often as you'd like. Know that just doing it once is also enough for now. And you will have a little more access now to these muscles and this brain to muscle connection as you start to move, reach for your baby, get up, walk the halls, go to the bathroom, whatever that next step is for you. So know that I'm here, reach out if you need me, and I'll see you in the next video, which is all about more functional movements in your day today as you move through this very early postpartum period.